Hi, my name is Lauren House, and I did my project on Broca's area. I find it very interesting in its functions and how it assists in language production. So, just an overview of what I'll be talking about today is the history of Broca's area, the location of it, the function, what happens if you damage the Broca's area, and some fun facts about it. So the book defines Broca's area as an area near the primary motor cortex in the frontal lobe that participates in speech production. However, there's so much more history and depth to this part of the brain that makes it very interesting to understand. This area of the brain's exact role was not known for 150 years. And for the longest time, all that was known about it was that it played a role of putting our thoughts into words. This area of the brain was discovered in 1861 by French surgeon Paul Broca, hence the name. And the only part of it that was known was that it played a vital part in articulating speech. So some interesting things about the location. In most individuals, Broca's area is located in the left cerebral hemisphere. This makes sense since the left hemisphere is dominant in language function. It makes up some part of the region known as the inferior frontal gyrus, which is found in the frontal lobe. So Broca's area is also known as the motor speech area. It is the Broca zone is assumed to be responsible for creating programs for production of language, symbols, and executing commands for the primary motor field. This area is near the motor cortex and utilized in speech production. It coordinates the activities of the muscles of respiration, the larynx, the pharynx, and as well as those of the cheeks, lips, jaw, and tongue. According to a study done by Johns Hopkins Medicine, it is finally found that Broca's area actually is active in the process of forming sentences before and is finished with its work before the words even come out of your mouth. So moving on to what happens if you damage the Broca's area. Damage to the Broca's area is known as Broca's aphasia. You may be able to understand and comprehend what a person is saying, but you are unable to speak fluently because the brain is struggling to communicate the movement of the muscles needed to form words. So symptoms include poor or absent grammar, difficulty forming complete sentences, omitting certain words, trouble with writing sentences, and difficulty reading. A few of the causes of Broca's aphasia is stroke, brain tumor, injury to brain, progressive neurological conditions like Alzheimer's disease or infection. The treatment of Broca's aphasia. So what can happen is Broca's aphasia may improve without treatment just because of the brain's plasticity, but working with a speech language pathologist can help improve your symptoms. And here's some fun facts about the Broca's area. The most common cause of Broca's aphasia, but not the only one, is indeed damage to the brain following a stroke. You'll see this a lot in older patients. Chimpanzees are the only other animal that share the Broca's area with humans, which makes sense why they can not necessarily communicate or talk, but they can, they have a language, they can learn American Sign Language. Broca's area shuts down during the active delivery of speech. So as you're talking, the Broca's area is not working, but it may remain active during conversation as part of planning future words and full sentences. And then I just decided to add this little quote in here. It says, quote, "It was difficult to hold Broca's brain without wondering whether in some sense Broca was still in there. His wit, his skeptical mien, his abrupt gesticulations when he talked, his quiet and sentimental moments." This quote was said by Carl Sagan. And basically, he wrote this book called Broca's Brain. He looked at it, he analyzed it, and wrote a whole book about it. And I thought that was interesting to add in there. That is all for my presentation today. Thank you so much for watching. Goodbye.